Yes.
And also the cost factor, do you think it has become more affordable now than it used to be?
Absolutely, absolutely. But now, I mean, when I think a couple of years back, even say 15, 20 years back, when we were on the learning phase of IVF, we hardly had few centers. We hardly knew few IVF doctors. Now I think IVF is just like become a very common treatment modality. And yes, absolutely, now with the government licensing and kind of strict, yes, strict kind of levels that the government is trying to have on every setup. Now again, I think the centers will be yes, very streamlined and very, yes, there will be all licensed centers that will be able to practice IVF, and that's in one way a very good kind of approach to the government to systematically, yes, put centers in place. Coming to the cost factor, yes, cost factors has been regularized. There's been quite a lot of kind of advances that have come up. One is the expertise available have become quite a number. So the consultant part of the consultant, yes, accessibility through patients is there. Obviously the lab technology has become better. We have trained embryologists now easily available, giving us good results. And obviously the gonadotropins, the pharmacological industry has made a lot of advances here. So the drugs that were a long time imported with huge taxes now are manufactured in India. And somewhere we should be thankful to Mr. Modi ji, our Prime Minister, for Make in India. So we have a lot of plans now coming in locally. So gonadotropins has become a very affordable thing for the patient now. Yeah. So I think all these things have, and now the competitive environment with IVF centers. So everybody wants to give it at a price where the patient can take it. So this is something which is again, a very big breakthrough in IVF clinics. Like, a lot of affordable IVF treatments have come in.
And another quick question is, a lot of people talk about rest immediately post-procedure, not being cautious about physical activity. Although it is needed post-IVF.
Scientifically, yes, I think if you talk to the patient about if you talk to them about scientifically about how rest would enhance an IVF pregnancy or the rates of embryo implantation, nothing to be really scientifically proven there. Probably when in countries abroad, they just have office transfers. Their patient comes in for lunch, and and they go back home, they go back to their clinics, they travel, they do their, because I think in the modern day scenario, where a lot of women are working, are into corporate businesses, they can't have the luxury of lying down probably just for a day, but you can't ask her to lie down for 10 days, right? So I think, and scientifically also, it is not proven that when you lie down, your embryo transfer results are great. Yes, psychologically, in some patients, maybe if a patient is psychologically the kind who says I need rest, it's okay, yeah. If your body is needing it, then yes. So it's all in the mind. It's all in the mind, yeah. So that's how it is, yeah.
Any other thing, ma'am, that you would like to just some to the common man, to the people watching the video? Anything that you would like to throw light on IVF from Kiran, ma'am? Anything else that you would like to add or talk about?
I think most of the part both of you have covered actually very well. You have gone into the indications of IVF, which was very important for our viewers to know. That what are the indications when they should approach. Even if there is a late marriage also, as she pointed out, immediately you should not wait for 1 year at that time. You should come within 3 to 6 months only to get good results. And if the husband's factor has been consistently very bad, and you are going from door to door, to increase the sperm count, it's not increasing. So then it's futile to go on trying, and wasting money also. So instead, if they go, that is better. And she mentioned about a hormone called AMH. So little bit, I will, little more give you more details about that hormone. Anti-Mullerian hormone, which is known as AMH, shows how much egg reserve you have in your womb. So if that hormone level has fallen below 1.5, then there's no point of waiting, because the pregnancy rates below 1 AMH will be very low.
Any chances of increasing that, ma'am, with medications prior to IVF? or
AMH is,
Yeah.
Dr. Shamla, actually AMH is one hormone which, like is very difficult to increase. But there are newer modalities have come in. I think in another video session we can cover, because that is also a long topic. But in short, I will tell you that, the new strategies which have come in is to inject PRP into the ovary. PRP is platelet-rich plasma to be injected in both the ovaries to increase the egg numbers, and little bit marginally it increases the AMH level also. And little bit more advanced, where the AMH has fallen to very low levels, would be to inject stem cells which you obtain from the patient's own bone marrow into the ovary. So I think those discussions we can have little more, like for that kind of people who come into that category. So that is the new advances.
Since we all know that IVF is a medical breakthrough, and thanks to this breakthrough that millions of couples have been given an opportunity to conceive, who otherwise would have never been able to become parents. Thank you, Dr. Kiran ma'am and Dr. Pratima, for giving us an insight into the IUI and IVF procedures. Ma'am, would you like to conclude this session, like an overview of what our discussion we had?
Yeah, I would conclude by thanking all of you present here, and sparing your valuable time, and giving your very important inputs into the subject, asking very interesting questions, which were really thought provoking. And I think we have been able to answer those questions. And what I would tell the general public, or my message or take home message would be to use these scientific advances and techniques. Science is after all for our advancement and for our betterment, isn't it, in all fields of medicine. So here in the field of reproductive medicine, we have this new technology which is being offered at a very reasonable cost in most of the centers here in India. That's why even we are getting more foreign tourism also, actually. We are getting patients from all
It's much
over.
affordable in India compared to the
Yes,
others.
Indian IVF is much affordable.
Yes.
Indian surrogacy is much more affordable. So like that, I would just say that use these facilities for your dream to come true. Whatever dream you have of becoming a parent, any center which is good, having offering you scientific services, please avail those services and become a parent. If that has been your idea to betterment of life.
Thank you.